Hi, I'm Holly Dietschman with Batavia Access Television, and we are at the BATV studios this morning with Paul Keener, the Executive Director of the Kane County Health Department. Our purpose today is to give you a little bit more information on what is happening behind the scenes at the Kane County Health Department and some changes that may be impacting its customers. So I'd like to give it over to Paul so he can give us a little bit more information about some of the changes in your department.
Where I would like to start really the conversation today is talking about the larger context for the recommendations that I'm making to the Kane County Board around public health services. And that context, of course, is the fact that we are in the greatest recession, I guess, since the Great Depression back in the 30s. And what that means simply is that government just can't continue to do business the way government has always done business. Specifically for the Kane County Health Department, we've lost about 10% of our revenue over the past 3 years. We've lost about $1 million in both grant cuts as well as lost reimbursement from sources like Medicaid. And so what was different this year is that at the end of June, when we received the proposed contract renewal from the Department of Human Services, first of all, it was very late, and that was because the state legislature really had not acted, and of course Governor Quinn was waiting to try to see if they were going to come back in session and solve the revenue issues. They didn't, and so we received this contract very, very late in the game. And the contract included a 4.5% cut to our family case management program, which is the single largest grant program that we have. And again, that was on top of these 3 successive years of cuts. What also happened this past year is the state started its late payment policy, where it has been paying bills either very, very late, sometimes as late as 3, 4, 5 months after billing. And what we understood from the state was that that policy was going to continue, and in fact, the length of time would probably lengthen. So all of these financial factors really kind of set the stage for me recommending to the board 3 things, 3 actions. And the first is that I'm recommending that the board no longer accept grants, large program services grants from the state of Illinois for 7 specific programs. And the second recommendation is that we then have to reduce the size of our workforce in order to be lined up with our new revenue. And then thirdly, because we are having to reduce our workforce so much, we really have to reorganize the department so that we can continue to provide the core services of public health to the citizens of Kane County.
So like we've heard for months, even years now, school districts, small businesses, large businesses, it's starting now, surprisingly, this late in the game, it really is starting to hit your department. But it really shouldn't come as a surprise to us because of the fact that really it's happening all over.
Well, I think that's really true, Holly. It's a terrible situation that we hope the economic indicators are starting to indicate a turnaround. But again, there's going to be a long climb out of this. And so having these reductions over the past 3 years and then continuing to get additional cuts just means that we in government have to think really hard about how we're doing business. We can no longer duplicate services. We have to become more efficient. And that's what we've really been looking at. And one of the key things that we've been looking at in the Kane County Health Department is really opportunities for partnership with community agencies. That's what we've discovered with looking at these family case management services, and our WIC program is that in Kane County we're very fortunate to have 3 federally funded community health centers whose total mission is all about providing access to health care for people with no insurance or who have Medicaid and really are underinsured. And we've worked very closely with these federally qualified community health centers for many, many years. We've partnered with them on many, many issues. But what we're looking at now is really transferring these services to the clinics because, again, it's a better alignment with what they do as their core business. It reduces the financial risk for the Kane County Health Department. And then what that does is really allow us to focus on those services for public health that no one else can provide. We're the only ones that can do restaurant inspections. We're the only ones that can follow up on communicable disease control. And we're really the only ones who have the ability to pull the entire community together around really important issues like childhood obesity.
So I'm a member of one of those 6,000 families, let's say, and I am used to, this is my usual procedure when this happens. For example, I think I'm pregnant, and I'm used to going to your the location across from Mercy, and I show up and I knock on the door and there's nobody there anymore. What do I do before I even get there, knowing that it's been cut or transitioned? How do I find out what I should be doing instead?
Sure. Well, the first thing to understand is that as of today, nothing has changed.
Okay.
What I have to do as executive director is make recommendations to our Kane County board. The board sets policy, okay, and then the department follows policy. Okay. So we anticipate the board voting on this resolution that would make these changes in early August. If they do so, then what we will do is contact each and every one of those 6,000 families and make sure that they know the answers to exactly the questions that you have. So current clients will get information directly from us, as we did last fall with our new flu outbreak. Yeah. We set up a hotline. Okay. We'll set up a hotline again so that people can call us directly and get information. We'll have information on our website. And then as we go forward, we will work with the federally qualified health centers, Aunt Martha's, VNA of the Fox River Valley, and Greater Elgin Family Care Center. And we'll work with the state Department of Human Services to really do a good job of publicizing these services to the entire community in Kane County so that once a new person, a new young woman, has that question of where do I go for a pregnancy test, she'll be able to get that information without walking in someplace and finding out that she can't get that service there. So we'll address those questions directly with the current clients, making sure they get information directly, and then we'll do an ongoing communications campaign with the entire community to make sure that they know where to get the services. And then finally, as we do every year with our report to the county board on community health priorities, we're going to continue to track these issues and these services, monitoring the quality, monitoring access, and we'll be issuing reports on that on at least a quarterly basis to our board and to the public, because I take accountability very, very seriously. We're a public agency, and we have to be held accountable to the taxpayers.
Our BATV viewers do have the luxury of being able to see the Kane County board meetings on BATV, so look for the August meeting where some of the decisions may be made. Yes. And if at any time, Paul, you're always welcome here to come back and give us an update on how things are going at the Kane County Health Department. You've always been a friend of BATV, and we thank you for that.
Well, thank you for the opportunity to share this information.